Hi everyone. In this video, I'm going to explain the three main layers of the skin: the epidermis, dermis, and hypodermis, and what you would typically find in each layer in normal skin, compared to what happens in necrotizing fasciitis, gangrene, and leprosy. I'll focus on what changes structurally and functionally across the layers. In normal skin, the epidermis is made of keratinized stratified squamous epithelium. Its major cell type is the keratinocyte, which produces keratin for protection and water retention. Other key cells include melanocytes for pigment and UV protection, Langerhans cells for immune defense, and Merkel cells for light touch sensation. The epidermis is organized into strata, like the stratum bile, where cells divide, up to the stratum corneum, where dead keratinized cells form a protective barrier. Underneath is the dermis, made mostly of connective tissue rich in collagen and elastin, giving skin strength and flexibility. In normal skin, the dermis contains most of the skin's structures, including hair follicles and hair, the erector pili muscles attached to follicles, sebaceous glands that release oil to lubricate the skin and hair, and sweat glands that help with cooling. The dermis also has blood vessels that nourish the skin and nerves or sensory receptors that allow us to feel touch, pain, pressure, and temperature. The deepest layer is the hypodermis, also called the subcutaneous tissue. It contains adipose tissue and loose connective tissue, which help with insulation, energy storage, shock absorption, and anchoring the skin to deeper structures. Importantly, larger blood vessels and nerves often travel through this layer. Now I'll describe necrotizing fasciitis, a rapidly progressing bacterial infection that spreads mainly through the fascia and deep soft tissues and can become life-threatening. Early on, the epidermis may look only mildly abnormal, like redness, swelling, or warmth. But as the disease progresses, reduced blood supply can cause blisters and skin discoloration. Eventually, the epidermis can develop necrosis, meaning the tissue dies. In necrotizing fasciitis, the dermis becomes severely inflamed and loses blood supply, so many normal dermal structures are rapidly destroyed. We won't properly find functioning hair follicles, sebaceous glands, sweat glands, or erector pili muscles in the affected area because the tissue is necrosing. Nerves can also be damaged. Pain is intense early, but sensation can drop as nerves die. Also, the blood vessels in the dermis and subcutaneous tissue become inflamed and often clot off, cutting blood supply so the skin structures and fat quickly die. In the hypodermis is where necrotizing fasciitis becomes especially dangerous. The infection spreads quickly through the subcutaneous tissue and along facial planes. The hypodermis can show widespread necrosis, fluid buildup, and destruction of fat and connective tissue. Because this infection spreads so fast, treatment often requires emergency surgery to remove dead tissue. Next is gangrene, which happens when tissue dies, most commonly from loss of blood supply, sometimes combined with infection. In gangrene, the epidermis may become cold, pale, and then dark as cells die. Over time, it can turn purple, brown, or black. The surface can become dry and shriveled in dry gangrene or swollen with blisters and drainage in wet gangrene. In the dermis, the key issue is ischemia, meaning too little blood flow, which reduces oxygen and nutrients. Because of that, dermal tissue dies. Hair follicles, sebaceous glands, sweat glands, and erector pili muscles stop working and can be destroyed, and nerves may die too, so the area can become numb as gangrene progresses. In the hypodermis, fat and connective tissue can also necrose. In wet gangrene, bacteria can spread through these deeper layers, leading to rapid swelling, tissue liquefaction, and foul-smelling discharge. This can progress to systemic infection. Finally, leprosy, also called Hansen's disease, is a chronic infection that mainly affects the skin and peripheral nerves, leading to patches of skin changes and loss of sensation. In leprosy, the epidermis may look relatively intact at first, but the surface may show dryness and reduced sweating, especially in affected patches. You can also see hypopigmented or reddish lesions. Over time, because sensation is reduced, repeated injuries can lead to ulcers that damage the epidermis. The dermis is a major site of changes. Leprosy causes inflammation and immune cell infiltration in the dermis, which contributes to skin thickening, nodules, or plaques depending on the type of leprosy. Crucially, leprosy affects peripheral nerves, and those nerve branches travel through the dermis. Damage here explains why lesions can be numb. Also, because autonomic nerves are affected, sweat and oil production can decrease, so the patch becomes dry and hair growth can reduce in that area. But the tissue is not rapidly dead like necrotizing fasciitis or gangrene. In the hypodermis, leprosy can extend deeper, involving nerves and soft tissues. Chronic inflammation may contribute to tissue changes and vulnerability. But a major clinical consequence is indirect. Because nerves are damaged, patients may not feel pain, so they get repeated injuries that can lead to secondary infections and deeper ulcers. To summarize, normal skin has a protective epidermis, a supportive dermis full of vessels and glands, and a fatty hypodermis for insulation and cushioning. Necrotizing fasciitis rapidly destroys deeper tissues, especially the hypodermis and fascia. Gangrene is tissue death from loss of blood supply, often turning skin dark and necrotic through all layers. And leprosy is a chronic disease of the skin and nerves, often causing numb patches and long-term tissue damage. Before I finish, I want to give a special thank you to my family for supporting me and helping me with my 3D models. Thank you for your patience and encouragement. Thank you all for listening. This was the 3 layers of skin, normal versus pathology, necrotizing fasciitis, gangrene, and leprosy.